Special venous collection techniques. Winged blood collection for accessing fragile veins. While accessing small or fragile veins, such as those of pediatric or geriatric patients, use of winged blood collection sets with 22 or 23 gauge needles is recommended due to ease in manipulation and reduction in stress exerted on the vein by modulating application of vacuum. A winged infusion set, also known as butterfly or scalp vein set, is a device specialized for venipuncture, that is, for accessing a superficial vein for either intravenous injection or phlebotomy. It consists from front to rear of a hypodermic needle, two bilateral flexible wings, flexible small bore transparent tubing, often 20 to 35 centimeters long, and lastly, a connector called either a female lure or a lure adapter that can fit on a tube holder. This connector attaches to another device, example, syringe, vacuum tube holder, or extension tubing from an infusion pump or transfusion bag. While using this device, the user must ensure that the connection is tight, otherwise there could be leakage or vacuum from a loose connection, leading to chances of froth formation and hence hemolysis. Needle sizes and color coding. The winged blood collection sets are available in 3 gauges, 21, 23, and 25. Higher the gauge number, smaller is the size of the needle. Holders. In case of evacuated collections, it is recommended to use wing set and holders from the same manufacturer to ensure compatibility. Holders are clear and are molded to a standard type. Wings or extensions at the sides of the tube end of the holder act as a lever against which the fingers or thumb can exert pressure to pop on or to remove the evacuated tubes, while continuing to hold the needle steady within the patient's vein. The reduced risk of accidental needle stick injury by protecting the blood collector from the non-patient needle is a major advantage of using holders. Disposable holders with needle attached are disposed of as one unit, reducing the risk of accidental needle stick injury. Do not attempt to remove the needle and reuse a disposable holder. The threads on the holder are only designed to be used once and may cause the needle to release during collection. Larger sharp containers may be required to accommodate disposable holders. Assembling winged blood collection set. When using wing set for evacuated closed collection system, holder is attached to the lure adapter of the blood collection set. While using wing set with lure adapter, a holder is attached to the wing set. This would allow the phlebotomist to perform closed blood collection using evacuated tubes. Winged blood collection set with safety shield. The wing set has a safety shield attached to the needle. After use, the patient end of the needle is easily and completely retracted into shield and locked in place, hence helping to reduce chances of needle stick injury after use. Majority of needle stick injuries happen within seconds of the device usage. The activation of safety mechanism immediately after usage would help in reducing such needle stick injuries. Site selection in hand. In case the veins are not visible, one could consider wrapping a warm, wet towel around the hand for a few minutes. Warming the site increases the blood flow and helps make the veins easier to feel. Where there is uncertainty about a vein, tapping the site sharply a few times may assist. This dilates the vein and makes it more prominent. The wrist veins tend to move or roll aside as the needle is inserted. Therefore, it is critical to hold the hand such that veins are well anchored. Site selection on foot. The blood collection from the foot veins should be a last resort after the arm veins have been determined unsuitable. Institution policies must be followed. Procedure. Venipuncture procedure. Grasp both wings of the blood collection set using index finger and thumb of the dominant hand, while anchoring the vein and keeping skin taut with thumb of non-dominant hand. Enter the vein at 10 to 15 degrees angle. If using evacuated collection system, push the tube into the holder using thumb, while index and middle fingers grasp wings of the tube holder. If using syringe, slowly withdraw the syringe plunger. Blood now begins to flow. While using evacuated collection method, follow the same order of draw as discussed under the section of phlebotomy. Withdraw the needle. Once last tube has filled and been withdrawn or required amount of blood has been withdrawn in syringe, put a clean gauze pad on site and apply light pressure. Gently and quickly withdraw the needle and continue applying pressure on site. Activating safety feature. Withdraw the needle while grasping the safety shield area with thumb and index finger. With opposite hand, grasp tubing between thumb and index finger. Push the safety shield forward until the shield locks in place. Discard the blood collection set. Discard the complete assembly without removing the holder into an approved safety box. Be aware, tubing attached to sharps can recoil and lead to injury. Maintain control of both tubing and the device during disposal.